First of all, I want to thank to the organizers of this seminar to call me here as an orator. My topic is diagnostic approach for women's health in Ayurveda. Now, you know that health of any person is important for the development of future progeny. But since women are those who carry the child since intrauterine life, they carry for 9 months in their womb. So the health of women are more important. In our country, older people, they talk yatra naryastu pujyante ramantre tatra devata. Where the worship of Nari is there, the God remains there. So, in this age, nowadays, there are many incidences of female feticide. People are killing the female child even in the embryonic stage. This is very hazardous. In our classics, Ayurvedic physicians have many tools to diagnose the diseases of the female and the maintenance of women's health according to the age, according to the reproductive life, according to the pregnancy, according to the post-pregnancy period, and after menopause also. So, here I want to emphasize on some tools and techniques which are described in Ayurveda as in general for examination of a general person. Though in those days this lot of advancement was not there, laboratory investigations was not present, but still then our rishis and acharyas, they were doing such practices to diagnose the disease as well as to know about the health and strength of a person. Now, next slide please. Now, this is a brief introduction. Future progeny is based on good health of a woman who is the integral part of the happy society. A healthy woman can give birth to a healthy child. If we analyze the life of a woman, it is full of physiological variations from childhood to old age. There are certain incidences and happenings which have deep impact on their health directly or indirectly. Now, Ayurveda finds a sound basis of treatment that is based on 3 pillars: philosophy or principles related to health and diseases, examination and treatment aspect. Examination of rog and rogi. Rog means the disease and rogi means the patient. Is very important in Ayurveda. There are different methods of examinations described in Ayurveda. There is not only one method. They have series of combination of methods. Like number 1, Dwivedi Pariksha, 3-fold examination. One is darshan, sparshan and prashna. Darshan means direct observing the patient. Sparshan means we examine the patient by touching. And prashna, it is the interrogation. We just interrogate about his health, about his disease, and then guess about the disease. In this series, the next important is the 4-fold examination: Pratyaksh, Anuman, Aptodesh, and Yukti. I think you may have also studied the darshan. In darshan also, Pratyaksh, Anuman, Aptodesh are mentioned. Pratyaksh means to directly perceive. When all the indriyas like chakshu eyes, or ears, all the etc., all this combined and they make a direct perception. That is Pratyaksh Pariksha. And Anuman means something is present but we guess about the previous or the disease health, disease state according to that symptom. Now, Aptopdesh means some Apt rishis with the knowledge which is authentic by some experienced person who has experienced their knowledge, and then they give written evidence or they have the oral evidence. On the basis of this, we do our own knowledge. And then Yukti. When all these three are combined and there is a logic approach towards a diagnosis, that is Yukti. In this sequence, Acharya Sushruta, I think you may have learned his name, he gave six-fold examination. Among these, Shadvis Pariksha, the five are the Indriyas: Shravanendri, Chakshuendri, Jnanendri, Sparshanendri, Rasanendri, and the last but not the least is the Prashna Pariksha. Prashna means the question. By interrogating the patient, we examine. Now, later on, the Acharyas thought that this was not sufficient to get the objective knowledge, because previous dividation was about the subjective knowledge of the patient of the disease. Now, to make it more objective, they had a series of eightfold examination: Nadi, Mutra, Mala, Jiva, Shabda, Sparsh, Drik, Akriti. Among this, Nadi Pariksha was very important, and it was developed by some ancient physicians, and they used this only technique for diagnosis the whole diseases. So they just saw the nadi means pulse. They just saw the pulse, and they were able to tell the nature of the disease present in that person. But that was authentic, but that was not practiced, and that was decreasing day by day. Because nowadays we have lot of advancements, like we have ECG, we can monitor different pulse rate, we can monitor different cardiac disease according to the pulse rate. But at that time, that was the only tool which was present to them. Now, Mutra. Mutra means urine examination. Mal means examination of the stool. Jihva, Shabda means some sounds like bowel sounds or chest sounds or palpitation. They were able to just by hearing or recognizing that sounds. Now, Sparsh, Drik means drishti or vision, and Akriti means the shape of the disease. So these are somewhat more advanced. Now, the above examination was disease oriented. Later on, it was thought that the patient itself, because Ayurveda, doesn't only treat the disease. The treatment is also based on the patient, because the treatment of the same disease, like in diabetes, the treatment of diabetes of a fatty person and treatment of diabetes of a thin person is somewhat different. In his Sthul Pramehi, the line of treatment is different, and in Krish, that is thin, it is different. So it is not only the disease which is important, it is also the person who is suffering from the disease. So there is tenfold examination. Now, number one is Prakriti. This Prakriti is decided since the combination of Shukra and Shonit in the uterus. And this is of two types, Deha Prakriti and Manas Prakriti. Deha Prakriti is like what you may have Vatik, Patik and Shleshmik, that which doshas are prominent at that time, the person is having that type of Prakriti. Similarly, Manas Prakriti, like Sattvic, Rajasic, Tamasic, these are the type of Manas Prakriti. Now, Vikriti. Vikriti means the disease itself on the patient. This is based on certain parameters like dosh, dush, Prakriti, Desh, Kal, Bal, Ling, means symptoms. So this is not only the nature of the disease itself, but there are so many parameters which decide the nature of the disease. Now Sar. Sar means there are 7 dhatus in a person. Ras, Rakt, Mans, Med, Asti, Majja and Shukra. So every person has some predominance of some dhatu. So according to that, it is divided into different sar. Tvak sar, Rakt sar, Mans sar. Which dhatu is predominant? That is to be observed in the person. Now Sanghanan. Sanghanan means compactness of a person. So a person may be sthul, may be fatty, may be krish, or it may be madhyam. Now Praman. Praman means proportion of body parts. So in Charak, there are different types of different parameters of the body parts are given according to Angul Praman. According to the Angul means finger of the person itself. So we can see the proportion, whether the person is of some Praman, all the body parts are proportionate, or it is Visham, that all the body parts are of different, not proportionate. Now Satmya. This is adaptability. The person living in different areas, having different types of food and having different types of behavior, this becomes Satma. He adopts the environment. So up to what extent he adopts, this is Satmya. Now Sattva, willpower. Only one disease affects a person which is of low willpower. So what happens? He thinks I have very big problem. But the person having willpower which is more, so they can think it is very less, I'll get well. So this also affects on the line of treatment. Now Ahar Shakti. Ahar Shakti means it decides the digestive power of the person. According to Ahar Shakti, if his digestive power is more, he can take lot of food and digest. And if his digestive power is less, he cannot digest. So the drugs which we will give will not affect him properly. So while diagnosing a disease, we should always assess the digestive power of a patient. Our chikitsa or our treatment is dependent on the Agni, the digestive power, Agni is the very important factor in the diagnosis of disease and treatment. Now Vyayam Shakti. Again, Vyayam Shakti is ability to do exercise. This depends on the practice of a person. Like an athlete can run up to hundreds of miles, marathon racer, but you can't run even 100 meters. So this is practiced. Now why? According to Ayurvedic classics, Vay is divided into 3, mainly Balyavastha, Madhyavastha and Vriddhavastha. Balyavastha is up to 16 years of age, Madhyavastha is from 16 to 60 years of age, and after that Vriddhavastha, and that is old age. Now in female, though these things are same, but since woman's life is full of variations, normal physiological variations are there since childhood of a young girl up to the old age. So for convenience, I have divided into 4 phases. One is the phase of Rajodarshan and Ritukal. Other one is marriage, pregnancy and menopause. Actually, this affects the whole physical and mental status of a female. Because nowadays there is lot of cutthroat competition. the parents are forced to put their children in young age to the school and then coachings. So the conducts which are told in the ancient classics, which are not followed. Therefore, lot of physical and mental disorders are present in this age. Young girls are unaware of this physiology, and there is nobody to tell them, there is nobody to convince them that it is the normal phenomena. But the parents have no time to give them and to assure them. They are getting this knowledge from internet, from television, which is hazardous. So it is advisable to learn to adopt the things which are given in Ayurvedic classes, though they are not possible in the same way which was done in the ancient years, but we can modify but follow those things. Now, childhood. According to Ayurveda, this stage lasts up to 16 years that I told previously, but in female, due to onset of menstruation, lot of physical and mental changes occur at the age of 12 itself. So, the childhood age is already decreased in the young girls. So, and in that time, girls are not aware of the things which are happening, the secondary sexual characters which are appearing in those girls. They are unable to understand that, and therefore lot of mental disorders are also present, and they are not able to tell to anybody, even to their parents, because they have no time. It is found that starting of menarche is directly related to the nutritional status of a female, means good nourishment is one important factor for timely initiation of menarche. Here, Ayurveda finds a significant role to promote female health, as Jivani Gan and Vayasthapan Gan medicines can be helpful to promote nutritional health of a female. Now, mode of examination in this stage. Young girls are shy. They are unable to explain their problems. So, only the Prashna Pariksha is very important. So, it is very important to take into confidence to those girls and then ask certain questions so that we can assess their problem and then do accordingly. Specific concerns. Due to lack of exercise, due to intake of fast food, cold drink, oily things, incidence of PCOD, polycystic ovarian disease, which was never heard before 10 or 15 years, but nowadays every fifth or sixth girl comes to our clinic and which are having menstrual disorders, amenorrhea, scanty period. So, and when we investigate, then we find there is polycystic ovarian disease. This is totally hormonal imbalance, due to totally imbalance of the hormones in the body. Now, if menarche does not start up to the period of childhood, then there are chances of anomaly related to the physiology of the reproductive system. Since female is generally not married up to this period, so physicians have to rely more on questioning, anuman and yukti, rather on inspection, palpation and instrumentation. To confirm our diagnosis, we can also use modern techniques like hormonal assay, FSH, LH, these hormones, prolactin concentrations, which are responsible for the normal functioning of the female reproductive organs and menstruation. This we have facilities, lab facilities, so that we can monitor the follicular growth, the ovum growth, abnormal USG, that ultrasound is possible nowadays to know the exact cause of the disease. Now, middle age. Up to middle age, that is after 16 years. The 12 to 16 years period was that which I explained. That was the period of unstable, that is not proper. Up to that period, female is not ready for the reproduction. But in the middle age, during this stage, energy, potency, strength, work capacity, retention power, memory, analyzing capacity, and all the dhatus are fully developed and psychology is stable. In our ancient classics, this 16 years of a female was supposed to be the age of marriage. That is again not possible in the present context because of the study, because of the career formation. Nobody can do marriage at the age of the 16. So, but 16 years of age was prescribed by our ancient acharyas. And now one thing more was given, that Atulya Gotra, the marriage should be done in Atulya Gotra of the persons were there, that Atulya, they should not be similar. Marriage should not be similar in same Gotra. So this Gotra concept was there, and this time lot of hereditary disorders, chromosomal disorders are having, because we are not following that regime. Now, Arthav is an important factor for pregnancy. Its purity is diagnosed according to color, smell, touch, and amount. In Ayurvedic classics, a typical symptom of the pure Arthav is given, which I will tell later on. As Arthav is considered Agni which is hot in nature, so in case of delay in menarche, Pittavardhak diet and behavioral regime should be suggested. Arthav, which is different in color, smell, amount from the normal, is not able for the pregnancy, or not good, not fit for the pregnancy. So for the having of pregnancy, we should have pure Arthav, in depriving which there are different types of Arthav Vyapad described in our classics according to doshas: Vataj, Pittaj, Kafaj, Shoritaj, Kudab Gandhi according to smell, Granthi Puti, smell, foul smelling, smell of a dead body, and it is less in quantity, and smell of urine, smell of stool. So these are different types of menstrual disorders which are described in our classics. Now, description of Yoni Vyapad. Yoni Vyapad is a broad term. Yoni is not only vagina. It denotes the whole reproductive organs. So, according to Ayurveda, if there is any anomaly in the reproductive organs, all the, including uterus, vagina, or fallopian tube, they all are included in this 20 types of Yoni Vyapad. Excuse me. There are four main etiological factors responsible for Yoni Vyapad. They are mithyachar, means abnormal diet and abnormal mode of life, means any disturbance in the Bij dosh. Bij dosh shows the chromosomal disorders, the congenital anomalies of the reproductive organs. Now, Dev or God, the conditions which ancient acharyas not recognize, they say that it is due to Dev. Nowadays we say it is idiopathic. The cause is unknown. Now, Acharya Charak and Vagbhata consider this stage up to 60 years of age. But for reproductive health, this span can be limited up to the menopause, that is 50 years. this I want to emphasize that though the division of the age group is up 16 years, Balyavastha, Madhyavastha up to 60 years, but in female, it starts from the 12 years of age, but and up from 50 years itself. 50 years itself, old age comes, and the cessation of menstruation is there. And this stage is decreasing. This age is decreasing nowadays. Early menopause is one of the most important factors for the osteoporosis, for the bone disorders, for the backache, and for the psychic disorders also in the ladies. Because this age is decreasing up to 40 years and 35 years, or even at the age of 30. The menopause is there nowadays. Our acharyas in Ashtanga Sangra, they have said if a lady takes diet containing grit, milk, and other healthy substances, this chiret tisthati artha, this age of menarche can be postponed. It can be up to the age of 50 years. 50 years was considered that. Nowadays, we see that most of the surgeons and patients are also very much aware that they have small problems like white discharge and come to the doctor and say that please do my hysterectomy because I'll have in the future some major disorders like cancer, and the doctors are also taking benefit of that, earning the money, and they do hysterectomy even at the age of 20s, 25, 28. This is again very much hazardous for the human being, because after the deprivation of the ovarian hormones, after the deprivation of the pituitary or ovarian hormonal axis, lot of mental disorders are there, lot of physical problems are there, which are including psychosomatic disorders, indigestion, and insomnia, anxiety, depression, and along with patients are becoming lay because they are unable to walk much, their joints are destroyed, their back is not working. So it is very important to follow our Ayurvedic regime so that this can be managed. Into the reproductive active period, each menstrual cycle is characterized by three main features. Now it is the dividation of the complete menstrual cycle, which is of about 28 days. The first is Ritusrav, that is the period of normal menstruation, that is from 3 to 5 days. And Ritukal, that is the proliferative phase. This Ritukal is given very emphasis in Ayurvedic classics. Ritukal Charya, the lot of regimes are explained in the Ayurvedic classics to what to do and what not to do, what conducts, what the different types of conducts, to sleep on some type of bed and then having brahmacharya, having normal diet, lot of things are there. Because they gave more emphasis on this Ritukal, because this is the time when if this sperm enters, then conception may be there. This is the most suitable time for the conception. Now Ritu Vyatit Kal. This is the secretory phase. The Ritu Kal is of 12 days, and after that uterus is ready to implant fertilized ovum, and the glands are secretory in nature due to the prominence of progesterone. Now Sushrut, equating germination of seed with achievement of conception, says there are four main features which are responsible for the conception: Ritu, Kshetra, Ambu, and Bij. Ritu means the season or period near evolution, that was Ritukal. Now Bij means seed, that is sperm and ovum. Kshetra, that is field, is the female reproductive system, and Ambu, that is water, which is the nourishing substances. These four assemble together in proper and appropriate manner, then only conception may occur. If anomaly in any of these four factors happens, then there is a problem in conception. While treating such cases, a physician should closely visualize the whole system. Physician should directly interrogate the patient about irregularity, amount, and other features related to menstruation, other associated problems, etc., mental status, degree of stress, family history, and other areas should also be closely argued. Now, here is an instrument which was described in Ayurvedic classics. This is so that we can directly visualize the uterus. At that time, no other techniques were there. X-ray was not there. Ultrasound was not there. Now the assay is now this is a diagram of Cosco's bivalve speculum. We see that that instrument is very similar to this instrument. This is nowadays used to examine the position of the cervix and other parts to now. Other modern techniques should be used to assist our diagnosis. We should not be only dependent on the above techniques which I have told, because at that time these newer techniques were not available. Nowadays, to visualize the position of the uterus and fallopian tube, HSG is there, hysterosalpingogram is there. We can directly see that the fallopian tube is patent or not. That was not possible in those days. So we can take the help of these measures also. But regarding the conduct and the diet, we can use Ayurvedic techniques. Now, there are certain more techniques to diagnose such diseases. Torch profile, which was also not present in the past. Torch infection, toxoplasma, rubella. Nowadays we can do, because these are also the cause of infertility. Now tuberculosis of the tuberculosis of the cervix or pelvic endometrium. This is one of the cause of the infertility. Sign and symptoms of early pregnancy is mentioned in the Ayurveda. Sadhyo Grihit Garbha, the symptoms of the recent conceived patient. No, they were able to diagnose the pregnancy even before the period of amenorrhea. Even before that, spitting, heaviness, malaise, sleepiness, horripilation, these were the symptoms of early pregnancy. After that, when the pregnancy is established, then also some symptoms were there, and lot of conducts were described in Ayurveda. So to diagnose and to follow that Masanumasic Vikaskram and its conducts, which type of diet is there, which type of this behavior should be there, how it should not be very heavy diet, milk should be there, so that the previously this vitamins and vitamin B12 and this calcium, iron were not given separately by tablets, and they were not available. This thing was fulfilled only by the diet itself, and the diet present at that time was very healthy. Now menopause. This, as I told, that in fact this is the last revolutionary phase in female's life. This may be sudden or gradual. There are a lot of physical and mental changes, and old age commences from this stage in female. Old age is dominated by Vat dosh. In this stage, osteoporosis is seen due to lack of ovarian hormones, A woman suffers from joint pain, backache, etc. There is hormonal imbalance which produces stress, insomnia. This all I told you earlier also. So this is in short the diagnostic approach of women's health in Ayurveda. So I want to thank, once again I want to thank the organizers of the seminar to invite me here. Now if you have any queries you can ask.
थैंक यू डॉक्टर सो आयुर्वेद में जो कंसेप्शन जो है ना कंसेप्शन जो मेंस जो कंसेप्शन हो रहा है उसमें जो कॉन्शियसनेस जो बोलते हैं हम लोग उसका कोई रोल है कोई इनफर्टिलिटी कोर्स जो होता है वो कॉन्शियसनेस माने नहीं होता तो फिर हम लोग जो सोवा रिग्पा में जो बोलते हैं अगर कॉन्शियसनेस अगर नहीं है तो फिर ये फर्टाइल नहीं हो सकते हैं ये आयुर्वेदिक में कुछ कहा गया है कि कैसे
It is given in the Ayurveda because in modern we see only the union of sperm and ova, but here Somanasya man. Somanas meant the lady should be of the should be inconfident. And other thing, there are Shat Bhav Samudaya. There are some six-fold samudayas: Matrej, Pitrej, Satmej, Satvaj. And this samudaya is also responsible for the status of the mental status of the lady, the adaptation of the lady. That is also important for the conception, not only the combination of sperm and ova. Yeah, it is given. Yeah, it is given. Huh? The particular term is not given, but it is there that from 12 years to Panchashat Chayam, 50 years of age, there is a stoppage of message. The Raj is stopped and the patient is like
I want to ask that in this day, when a woman become pregnant, then so many injections are there and so many tablets are there, and after then in according to the West, this day they are avoiding to get such a injection and to taking such a pills and all these things. They said that so many countries in Europe, they are not giving in this day. Just supply the good food, provide a good nutritious food. That is enough for that. So it is. So what do you think about this thing?
Yeah.
Then another question is that, and I heard that instead of giving the medicine, tablets and injection, the West, one thing is doing that when baby after the labor delivery, the placenta, which is come with the baby, they make a pill of the placenta and then give that placenta in the form of the pill to the mother. So what is? Do you have any consideration of this?
Actually, the placenta is described in apara, in the form of apara in the ancient days. And then apara, that formation was there with the ladies' blood and etc. So this is, I think it is not so mentioned in this form to take the placental stem cells. That I think you are telling about that thing that the placenta is preserved and then it is used, but it is not given in Ayurveda in our classics. We can some people claim that it is given, but in our classics it is not given in that form, which is sufficient to explain this type of things.
Subgotra,
Yeah.
you see,
Yeah,
when any persons, the couples, they are married in the same subgotra, then the disorder occurs, this heritage disorder and chromosome disorder. Is this a scientific?
yeah, it is scientific. There are a lot of sex-linked disorders. You may have hemophilia. You may have this pseudo hypertrophy of the muscles of the lower limb. So this type of disorders are there, which are present in nowadays. So it may have some scientific basis.
Thank you, Dr. Bhavana ji, for giving such interesting lecture. So now I request Dr. Srin Samjela, Secretary of Central Council of Tibetan Medicine, to offer the assurance and certificates